WHO launched baby-friendly hospital dialogue with private hospitals based on the 10 steps to successful breastfeeding. The BFHI focuses on providing optimal clinical care for new members and their infants. There is a substantial evidence that implementing the 10 steps significantly improves the breastfeeding rates.
This dialogue targets private hospitals in Kuwait to promote understanding of the BFHI program, the 10 steps to successful breastfeeding, and importantly, country-level implementation of the BFHI barriers and opportunities. Discussions also encourage exploring of more sustainable ways to ensure that care is delivered consistently to pregnant women, families, and infants. Hadil Fahad has more.
Since 1991, the Baby-Friendly Hospital Initiative has helped to motivate facilities providing maternity and newborn services worldwide to better support breastfeeding. The BFHI focuses on providing optimal clinical care for new mothers and their infants.
We all know that breastfeeding is beneficial. We all know that it has good effects on the baby's physical development, mental development, intellect, and even years after the baby is born, 30, 40 years of age, he or she is still reaping the benefits or otherwise of the feed which was given to him or her at birth and immediately after birth. So we are all convinced of that. Yet, we don't see those results. So there is a no-do gap. This is that we know the thing, but we are not doing it. There's some barriers. There is something which is obstructing us as individual or as a society or as an institution which is not letting us take that step.
Less than 20% of births occur in baby-friendly hospitals in Kuwait. Given that only 2 hospitals are designated BFH in the country, there is a great opportunity for progress.
In Kuwait, there is a law, and it is a well-established law for implementation of breastfeeding substitute code. So, in this current times of information and more so misinformation, which is very easily accessible on social media, electronic media, press media, it is even more pertinent to think about all the aspects which can lead us to a better environment for our mothers, for our babies, to have access to appropriate feeding practices.
This dialogue targets a private hospital in Kuwait to promote understanding of the BFHI program, the 10 steps to successful breastfeeding, and importantly, country-level implementation of the BFHI. The WHO launched the Baby-Friendly Hospital Initiative to encourage health facilities worldwide to better support breastfeeding. Hadil Fahad to Kuwait English News.